Under physiologic conditions, BRAF is activated by upstream RAS, and the association of BRAF with activated RAS leads to heterodimerization, for example, CRAF with BRAF heterodimers, or homodimerization, BRAF with BRAF. This pathway is tightly regulated with several levels of negative feedback control that limit the physiologic activation of MAP kinase signaling. But BRAF alterations can be grouped into three classes on the basis of how they signal. So class 1 BRAF mutants are typified by BRAF V600E, and these signal as constitutively active monomers. They do not require RAS for activation, and they strongly activate ERK and feedback suppress upstream signaling. Non-V600 mutations are subclassified into class 2 mutations, such as K601, and these have intermediate kinase activity and signal as constitutively active RAS-independent dimers that suppress upstream signaling. And then there are class 3 mutations, such as G469E, that have impaired or lack kinase activity and signal as RAS-dependent heterodimers. Class 3 mutations bind more tightly than wild-type BRAF to RAS and amplify signaling through wild-type RAF and mutant wild-type RAF heterodimers. They often coexist with other upstream mutations in the pathway as well. So approved BRAF inhibitors, including Vemurafenib, Dabrafenib, and Encorafenib, inhibit constitutively active BRAF monomers, such as BRAF V600E, but are not effectively able to inhibit class 2 and class 3 alterations that signal as dimers. RAF dimer inhibitors are in development, and they inhibit both dimer partners and are in fact effective in preclinical models of cancers driven by class 2 alterations and to a lesser degree class 3 alterations as well. Dimer breakers are also being studied, and these block dimerization, which is required for class 2 and class 3 alterations to activate ERK. There are numerous ongoing clinical trials testing dimer inhibitors and breakers alone and in combination with downstream inhibitors, including MEK and ERK inhibitors. And the majority of these trials are ongoing with limited data presented thus far. Class 3 alterations may require inhibition upstream that reduce the amplified RAS signaling, such as Cetuximab, which blocks EGFR in colorectal cancers with BRAF class 3 alterations. So that technique is also being studied as well.